Hello, this is Sudharshan, and in this episode PH 1.24 renal system part 2, we will see antidiuretics. So this is a class where the diuresis is blocked and the main antidiuretic agent is vasopressin. It is physiologically also called as antidiuretic hormone. So this is a hormone that is secreted by the posterior pituitary. And here we have to know two important receptors, V1 and V2. V1 is divided into V1A and V1B. So V1A will act on four important sites: blood vessels, GI, liver and platelets. So coming to V1A, in the blood vessels, vasoconstriction; in the GI, it increases the motility; in the liver, glycogenolysis. Just like we have the beta-2 receptors in the liver where glycogenolysis occurs, somewhat like that. And with platelets, it causes adhesion, or I would say aggregation. And V1B is present in the CNS and uterus. So CNS, it helps activating HPA, or hypothalamo-pituitary axis, so that there can be release of ADH from posterior pituitary. And with uterus, it will act on the GPCR, G protein coupled receptors in the myometrium of the uterus, and thereby the oxytocic effect will be there. And V2 receptors in the renal tubules, where there will be increased water reabsorption and the dilute urine is converted into the concentrated urine. So this is a basic with the receptors. Now there are four important synthetic antidiuretics, vasopressin analogs like desmopressin, arginine vasopressin, lipressin and terlipressin. And very commonly used is desmopressin. And with the receptor actions, desmopressin is selective to V2. Okay. Arginine vasopressin mostly at V1. Lipressin and terlipressin will act both on V1 and V2 receptors. And from the name arginine vasopressin, it should have highest vasopressor effect. But antidiuretic effect is highest with desmopressin. And coming to the uses, one use in abdominal radiography, gas expulsion. Then for the treatment of portal hypertension, where we see esophageal varices, that is bleeding from the esophagus, right? And where there is mesenteric ischemia, so portal hypertension in short. And also in diabetes. So diabetes is an important one. We will see. So two are there. One is central and nephrogenic. So central means it is acting on the brain. So ADH secretion reduces. In nephrogenic, it is opposite. Nephro means kidney. Genic is formation. So it should act on the kidneys. There is enough ADH here, but kidney is not responding to ADH. And coming to the drugs which are preferred. Desmopressin in central, and very commonly we are going to prefer thiazides in both central and nephrogenic, but difference is chlorpropamide, which is an antidiabetic agent in central, and in nephrogenic will prefer a potassium sparing diuretic like amiloride and an NSAID like indomethacin. And side effects are opposite to the physiological actions of the V1 receptor subtypes, as I've already discussed. So that was all with the antidiuretics. So thank you so much. We'll see you in the next lesson.